Hey, everybody. Thanks for being here today. Super excited to see everybody. We've still got some folks logging on. If you did not hear me the first time, if you haven't put your name and organization in the chat, if you'll go ahead and do that for me, that would be great. And we will go ahead and get started. So at this time, anybody who's got an event or activity or wants to share about their program, whatever you want the full collaborative to know about, we're going to open the floor for anybody to share. So y'all share away.
I'll go first since it's kind of quiet. Hi guys, my name is Shauna Johnson. I'm a health educator here at the Carter County Health Department, and I am super excited to announce that we're going to finally be able to hold our very first event here at the Carter County Health Department since COVID. What we're going to do is have a community baby shower. Right now, the date is scheduled for April the 13th, 2024 from 1 to 3 p.m. here at the Carter County Health Department. This is a targeted event, so we're looking to target our populations for expectant mothers, parents, caregivers, people that may be adopting a young child, and children ages birth to 5 years of age. It's an entirely free event. We'll have diapers, food, games, swag. The River Riders will be here. We'll have a resource fair featuring our wonderful community partners. And we'll also have some raffles for some door prizes to give our parents and our families too. So we're super excited about it. We're also going to offer some community services too, like fluoride varnish application, immunizations, and some screenings. And I'll put the flyers in the chat. If you are interested in attending, please spread it far and wide. We want to have as many mamas as we can turn out and as many families turn out. If you are interested in being a vendor, I will also put the link and a QR code in the chat for that as well. And I have one more event to share, and then I'll turn it over to somebody else. The Carter County Health Department will also be offering fluoride varnish application in the Carter County school systems. We'll be doing that on March the 18th, 22nd, April the 2nd, and April the 3rd. Those packets have been sent out through the school system. So if you know a child or a family who might want to have their child receive some fluoride varnish application at the school, all you'll need to do is go speak to school staff and they should be able to give you a packet, because you will need guardian or parental approval to get that fluoride varnish application. And I will also put that flyer in the chat and some information about fluoride varnish if those of you don't know what fluoride varnish actually is. It's a protective coating that is painted on teeth to help prevent new cavities and help stop cavities that have already started. It's approved for ages 12 months and up, no pain, no bad taste, ADA approved, and it starts working as soon as it comes into contact with saliva. So real quick application, kind of protects those kiddos' teeth, since we know dental is a huge issue here and we seem to be losing more providers than we're gaining. And thank you so much for your time.
Hi, everyone. This is Marissa Muse with Village Behavioral Health. I just want to tell everybody know that we do currently have openings for boys and girls ages 9 to 17 with a mental health and substance use disorder. And we are located in Knoxville, Tennessee, but we do serve the nation. So we even get kids from Hawaii. It's crazy. Thank you.
I'll share. My name's Corey Johnson. I'm the new Northeast Regional Director for the Tennessee Suicide Prevention Network. We provide suicide prevention, education, information, trainings, and different services for basically any community organization. So if any of you ever need materials, if you just need someone to come in and talk with students or staff or leadership about suicide prevention, mental health education, reach out to me, and either myself or I have a team of volunteers in the area that are professionals in behavioral health. We would love to help. One thing I do want to mention is currently the Tennessee Suicide Prevention Network has received grant dollars from the state of Tennessee to implement a program throughout the schools across the state called Sources of Strength. It's an evidence-based suicide prevention program developed several years ago by a former law enforcement officer in the Northwest. I don't know exactly which state, but several school systems and states across the country have already implemented Sources of Strength, and we're trying to kind of get in on some of that. And so the state of Tennessee has given us funding to grant a free program, implementation, training, materials to 15 schools in the state of Tennessee. And those dollars run out August 31st. So right now we're really trying to reach out to any schools, basically middle schools and high schools right now. So 6th through 12th grade are what we're looking at. The program typically costs about $6,000, but the state will pay the entire cost per school. So even if you work for a school system, if you have multiple schools within your system who are interested, we can provide a grant funding for each school. And essentially the program involves a group of adult advisors, but one thing that is really amazing, in my opinion, about the program is it's peer-led. So there will be a group of students in each of these schools identified as leaders who can speak to the things that they feel like their peers need. They'll obviously be trained, they'll have a lot of guidance. And another thing, if you know anything at all about suicide prevention, there's something that we talk about a lot called protective factors. This program really focuses more on the protective factors than the risk factors, which I really love. So right now we're in the process of getting general interest forms signed because the agreement that the state has given to us is if schools sign the general interest form saying they're interested before August 31st, we can actually still implement the program beginning next school year because we know it's March and schools are not doing anything new right now. So I've put my email in the chat. If there are any school systems in our area, again, middle school and high school, and you might be interested in getting more information, I would love to talk with you. I really would love all the money to come up to Northeast Tennessee, honestly. So thank you guys for letting me be here.
Hi, I'm Elizabeth. I'm new here. I'm with Tennessee Voices, and I help promote our program called FAST, which helps families with youth who might be struggling in school, sports, behavior, mental health, anything like that. And we help families walk through those processes and help those families learn the skills so they can advocate for their children. And so this program is free, and we actually, I'm located here in the Middle Tennessee area, but we have a family support specialist who's the one who walks alongside these families, who's located in the Carter area. So she is serving Carter County and the surrounding counties. So if you have any families you think that could benefit from our services, I dropped my email in the chat. Would love to hear from you, send you our referral form, and talk more about our program. But thank you so much.
Hey, I'm John Knack with Creekside. I just want to remind everybody, something I don't talk about enough is our outpatient services at Creekside. We have IOP and PHP. We get a lot of step-down folks from inpatient, but it's also a great program as a prevent for people that have chronic ongoing behavioral issues but don't qualify for inpatient. And we do have Zoom options available for adults and kids. I've left some information in the chat if anybody has any questions. I know sometimes the court likes for folks to do some kind of program to better themselves in order to get even custody or something like that. And we do have a graduation and a certificate of completion. So again, my information's in the chat. Let me know if you have any questions. Thanks.
I will go next after John. My name is Amanda Crawford, and I'm with Health Connect America. I'm the clinical supervisor. So in regards to where we're located, we are right next to the Tipton Haynes historical site. So we're closer to the Carter County side of Johnson City. And it's one of our biggest areas. We do a lot of different services. We're currently hiring someone for our IOP program for substance use and mental health. Currently, since we don't have one, we refer a lot to John Knack and Creekside. We also refer a lot to Frontier for that service. We do in-home services 3 times a week. We currently have availability in the Carter County area. And that is just to help support making connections, working on therapeutic needs, for children that are at risk of being removed from the home or at risk of going into a higher level of care. So we just try to keep those kids in their homes and their schools and help them be successful. Aside from that, we also have some outpatient case management and medication management openings as well. So I will send out our flyer that I made, but if you all need anything, I'll put my email in there too.
Anybody else have anything before we move on? Okay, well, I'm gonna go ahead and turn it over to our speaker today. Emily, I just made you, I think, able to share. And I will turn it over to you.
Thank you. So my name is Emily and I'm a community educator for CHIPS Family Violence Shelter here in Erwin. Today I'm going to be talking about our program and the services we have to offer. Let me see if I can go ahead and get my screen and start sharing. Can everybody see that okay?
Yes, we can.
So CHIPS stands for Change is Possible. So a little bit about who we are at CHIPS. We're a domestic violence program. We were founded in 1992. Since then, we've provided a variety of services to Carter County, Greene County, and Unicoi County, including our emergency safe house. Our mission at CHIPS is to provide shelter and services to victims of domestic violence and their children that will enable them to live a life free from violence. So a couple of our services that we do here are community education, which is what I do. We have a court advocate, rapid rehousing coordinator. We also have a 24/7 crisis hotline, and we have 2 emergencies. So a little bit about me. I present on a variety of topics. Our services, which is what I'm doing today, domestic violence, elder abuse, healthy relationships, teen dating violence, bullying, stress coping skills, and I just go into schools and other organizations and talk about our program and really do outreach to bring awareness to our program. So our 24/7 crisis hotline is a confidential line that victims of domestic violence can call and speak with an advocate at any time. Our advocates can safety plan with callers, and I'll go over that a little later on how to create a safety plan. I know some of you may already know how to do that. We offer emotional support through those calls, and we can assist in cases where callers will qualify for shelter. So our court advocate assists in filling out and filing the order of protection with our clients. They also provide advocacy and support during court hearings. They assist with victims' compensation claims. They can provide referrals to legal aid and provide advocacy during criminal proceedings. So we do have a rapid rehousing program for our shelter clients. So we can assist victims of domestic violence currently in shelter as they transition into permanent housing by aiding with a portion of rent and utilities. We really try to base that off like a case by case, like what does the client's need at that given moment. So a little bit about our safe house. It's for victims who are actively fleeing domestic violence, safe, confidential, and we have it stocked with food, underwear, all the things that you might need while you're staying in the shelter. Inside of our shelter, we have shelter staff who are there for emotional support and anything that the client might need while they're staying. Another great asset to our program is our thrift store, which is actually right next door to our office downtown Irwin. The proceeds from the thrift store go to our safe house, and it serves the families that live inside of our safe house. Another great thing that our thrift store has to offer is a merchandise voucher that we can give out to our clients in case they need clothing, things for their babies, like car seats and stuff. So if you know someone that needs help, you can help create a safety plan with them. Here's some things what not to do and what to do when you're talking to a victim of domestic violence. Always listen without judgment. You can always just start an easy conversation by basically stating like you're concerned. There's those signs. Believe them. Believe their story when they tell you. And always validate how they're feeling. Offer support like shelters and resources. Some people might not want to come to shelter. A lot of people, like if they have to deal with like DCS and stuff, they feel the pressure of having to come to shelter. And like I had said before, you can help them form a plan, which I'll go over in the next slide. A couple things not to do is talk bad about the abuser. Just because someone's being abused doesn't mean that they hate their abuser. On average, a woman will leave 7 times. She's completely finished. Don't ever put the blame on the victim because I'm sure they've had that done to them enough. Don't underestimate the situation. You weren't there. You don't know what happened. What they could be telling you might sound crazy, but it's very possible. Don't promise them help. Because it's kind of self-important, that one. Because a lot of places out there, they might have full beds, we've had trouble getting people out of our shelters because they've been safe sometimes. So that's kind of a wall that you kind of hit there. Don't ever pressure the victim into staying anywhere or doing anything about the situation. Don't give up on them. Just because they don't want to act right now doesn't mean they won't want to act later. And asking what they did to cause the abuse, that's kind of going back to putting the blame on the victim. Because their abuser, a lot of the times the abuser will make it seem like their fault that they're getting abused. Safety plan. During our hotline calls, we do create a safety plan with the caller. A lot of times we tell them to pack a bag, keep it where nobody else can find it, but it's still easily accessible to get out fast. A lot of things that we tell them to put in the bag are important documents like ID, social security cards, car keys. If they're coming with children, we tell them to get those documents for their children as well. Make an escape plan. And if you have children, teach it to them and make sure that they know what to do if they need to get out fast. If you have neighbors around you, we ask them to look out for the client. If anything isn't normal, I guess you could say, they could either call the police or ask somebody else. And this one's not all the time really possible because control and things like that. But we also ask if they could keep a phone close by. That would be great because they can, for one, call the police, call somebody they know that can come and help. So here's a quote from one of the survivors that we had worked with. It says, "I don't care if I'm approved for victims' compensation. I don't care if they catch him and charge him. I'm just thankful that someone listened." So it really goes to show just what listening to somebody and believing their story and being understanding and just being there for that person really does. And that's kind of what we do here at CHIP is we help people by listening to them. We offer emotional support over the phone. Even if they're not wanting shelter, we're always here to talk. Yeah. Does anybody have any questions about CHIPS or what we do or anything like that? Well, if nobody has any questions, if you have questions that you think of later, you can drop them down in the chat, but I'm going to turn it back over to Jillian and I just want to thank you guys for listening today. And you guys ever want somebody to come out and talk to your organization, I am available.
Thank you so much for sharing. Any questions for her or anybody else hop on that wanted to share something before we move into our committees?
I had a question. So you'll serve the whole region, or I guess you'll serve Carter County, but you're located in Unicoi?
We serve Carter County, Greene County, and Unicoi County.
Yeah, even with the health education?
Yes, we can go outside of that. We just have to be asked. So like if somebody in Washington County wants me to come talk to their organization, I can't reach out to them. They would have to reach out to me.
Thank
All right, thank y'all so much. I'm gonna ask each of our committee chairs to share what you all will be working on in your groups today. So as a reminder, Committee A is our Substance Use Committee, chaired by Tia Hughes. Committee B is chaired by Gabby Smith. And Committee C is chaired by Emily Matthews, and is our Data Collection Committee. So if I can have each of y'all share what you'll be working on today, and then we'll break into our committees.
So in Committee A today, we're going to be talking about the Day of Hope event that is going on tomorrow and kind of seeing if there's anything that we need to tie up loose ends on.
Hey everybody, I'm going to be filling in for Gabby today on the second committee. We're going to be discussing some food insecurity topics today in a recent meeting we had with some folks outside of the state about getting some healthy food initiatives into Carter County.
I'm with Committee C, but before we break out in groups, did we need to officially vote on our strategic plan as a whole committee during this meeting? Or do we want to wait to do that on our in-person meeting coming up?
I think in person might be better for that.
Okay, we had just discussed making sure we get an official vote this month, but we can do that. So in Committee C, we are just going to be talking about some of our items from the last meeting, working on our strategic plan and discussing some potential help that we're getting, or know that there's some interns coming along soon and work projects for them. Continue to reviewing regional data. And then, yes, just reminding everyone, please come to our in-person meeting. That is gonna be March, I'm losing my calendar. Is it 14th?
Yes, it's going to be March 14th at the Carter County Health Department from 12 to 1:30. Lunch will be served. If you all see a reminder from me, that is the reminder for the in-person meeting. Just make sure you're reading those emails. And the RSVP link is toward the bottom of those.
All right, and then I'm gonna try to help Phil and create some breakout rooms. So just a minute, I'll be making those and then you can add them if they pop up.
Tyler, either Tyler, Jillian, or Emily probably can answer this question. Can we, I know, for other health councils, we can do this, but can we participate in subcommittees if we're not officially a member of the health council or the collaborative?
Of course, we invite you
Okay.
to.
Great. I just wanted to make sure. Thank you.
Okay. This is my first time making the room, so I think I've opened them all. I hope everyone can join the room now.